Stop! If your ankle hurts and you can't do stuff like this, and if you don't know if you sprained, strained, dislocated, or broke your ankle, you need to watch this video. Here you'll learn how to identify what's causing your ankle pain, how to treat your ankle pain, and I'll answer any frequently asked questions about your ankle pain. So there are 4 main reasons why your ankles can hurt: sprain, strain, dislocation, or broken. An ankle sprain is basically the ligaments between your bones surrounding the joint can get overstretched or torn with an abrupt twist or roll of your ankle, and then that can cause swelling, edema, pain around the area that's pretty localized, and difficulty with walking. So a strain involves muscles instead of ligaments. So muscles are tendons that are attached to the bone instead of from bone to bone. So that usually is from overstretching or overuse, but more commonly you overuse that foot ankle, something repetitive like skating, jumping, sports, you come out of days. It feels more sore basically. You can tell if the ankle is strained if you have some swelling, muscle weakness, pain with using that muscle, and sometimes difficulty standing or walking. So for sprains and strains, if you think you have those, come see us. We're trained medical professionals to evaluate, diagnose, and treat. The next 2 sets are going to be a little bit more severe, and I would like you to go see an ER or urgent care center so you can get imaging and proper treatment for that. The first one's a dislocation, where the bones are forcibly removed or shifted from the joint, and then that can cause very severe pain, deformity of the joint. You're not going to be able to walk, and there's going to definitely be swelling and bruising around the area. How to identify that is that you look at your ankle and it's kind of hanging there. So I definitely recommend you go into the ER or urgent care, get that x-rayed or evaluated. Fracture though, that's when you have a break in the bone. That could occur in like the tibia or any part of the smaller bones in the ankle or the foot. So if that happens, there's also severe pain, swelling. You can have deformity as well, very point tender. So you can also break your ankle or fracture it. That can happen to the tibia, fibula, or any of the smaller bones of the ankle or foot. You're gonna have severe swelling. You're not gonna be able to walk. If it's bad, you can see deformity and you're just not going to be able to move it around. If it's a hairline fracture though, that's usually from overuse. So you typically would have some pain and you do a sport that's very repetitive, but you don't really know what caused it, and we ruled out sprain and strain and dislocation. You might have a hairline fracture. Proper diagnosis is with an x-ray. So if you have a sprain or strain, come to Kaiser Health. We'll get that evaluated and treated. We have different techniques to treat your ankle, such as soft tissue work, which will help break up anything that is swollen still, painful, get good blood in there basically to heal it faster. So after mobility, we'll do stability exercises, which will help re-strengthen the ankle so that you can function again, basically walking, running, jumping, or any sports that you do. We also have other modalities such as normatec compression therapy, so if the ankle's pretty swollen, especially if it's very acute or subacute, that helps with pushing out all that lymphedema, swelling out of there, and also help control pain. We also have TENS units or an E-stim, which will help modulate the pain as well. And then once it gets into more of the subacute phase or when you're improved again, we can also introduce potentially shockwave therapy. Also, if you had chronic ankle issues or if you sprain them all the time, that means that you have a stability issue. So we'll come in and we'll treat that in terms of re-strengthening the ankle, so you stop rolling your ankle, stop spraining it all the time. Or if there's something else going on and you have sprain and just never went away from years ago, you might have some scar tissue in there. So shockwave therapy and dry needling would be appropriate action steps to take so we can trigger that inflammatory process and heal it again. So come to Kaiser Health. We train ankle sprains all the time. We'll get you back into your day-to-day activities or rec leagues or sports and athletes. With Kaiser Health, you can get back to what you love.